Hello, this is Corey Scarpaccio. Thank you for joining me here at Corey Dental Sales. I want to talk to you a little bit today about Onset by OnPharma, but even better, I have Spencer Roan, who's from the company. So let's see what Spencer has to say about it.
Hey guys, I'm Spencer Roan. I'm with OnPharma. We got a very exciting product to talk to you about today. For those that are not familiar with Onset, we have a product that buffers local anesthetic. So I wanted to kind of keep this as high level as possible. If you are not familiar with buffering, right now, when you give a unbuffered injection of local anesthetic, essentially what you're doing is you're relying on the human body to take acid in that local anesthetic up to a physiologic or neutral pH. So it always takes some time for the patient to buffer that local anesthetic, which is why on average it takes anywhere from 10 to 15 minutes for a patient to have pulpal anesthesia. It also burns and stings. Some patients may make you aware that injection hurts. Other patients, it won't. But when you give a unbuffered injection of local anesthetic, it burns and stings. And it also, that onset time, it takes time. It takes anywhere from 10 to 15 minutes. Now you probably have some patients where you're able to get numb a lot quicker than others. You may have those patients where you just simply can't get that numb, where you're going in with 2, 3, sometimes 4 injections to try to get that nerve tissue numb. But what buffering with Onset does is we're no longer relying on the human body to buffer that local anesthetic. This product does that for you outside of the body. So when you give an injection of buffered local, we're finding that about 70% of patients will have pulpal anesthesia in less than 2 minutes. Typically on average, it's 60 seconds on uppers and 90 seconds on lowers. So the onset time goes from 10 minutes, sometimes 15 minutes, all the way down to less than 2 minutes. And it's also a comfortable injection. You can ensure that every single injection you give that's buffered will be a comfortable one for the patient. So you're no longer gonna have that burn or sting. So what we're doing is, I'll just quickly show you how this product, how you administer the buffered local.
Sounds good.
So you're taking whatever local you're currently using. If that's articaine, lidocaine, prilocaine, bupivacaine, any local is compatible with this Onset mixing pen with the exception of bupivacaine.
So bupivacaine, they cannot use with this buffering system.
That's correct. Bupivacaine is the one local anesthetic that's not compatible with this system. What you shouldn't have an issue with, a very, very small percentage of the market is using bupivacaine, and less than a percentage of the market. So you should be good with whatever local that you're currently using as long as it's not bupivacaine.
Got it.
Important to note that this pen, a lot of doctors, they see this pen and they're like, oh my goodness, is this coming in contact with a patient? The answer is no. So what we're doing with this pen is we're buffering outside of the body, chair side. So you're taking whatever local anesthetic you're currently using and you pop it right into this cartridge connector. Okay, so once it's in there, all you're doing, I don't know if you can see those arrows, but there's the 1, 2, and 3.
I see.
So what you do is you twist, you push in, you're dialing this to 9, which is, it's measuring precisely the amount of sodium bicarbonate that you're injecting into the local anesthetic.
So Spencer, I'm gonna zoom in just on that 9. Now, if there's a 9 that we have to get to, why does it dial to other numbers?
It's a great question. So that was the case with, we call it the Onset 1.0, the first version of this product. Prior to 2017, you were dialing an office, a doctor would dial it to 9 for some locals and 18 for others. So depending on what local anesthetic you were injecting with, you were dialing to a certain number. You were essentially measuring at a different amount of sodium bicarbonate that you were injecting in the local.
So you're saying that's not the case now?
That's not the case. So now you just got to remember 9. 9 is the number you use for any local anesthetic that you're popping into this mixing pen. So once you dial it to 9, you're pushing this button in, and what that essentially does is it injects sodium bicarbonate into the local anesthetic. So now all you do is just reverse the steps, pull out, twist, set that mixing pen chair side, and you take your carpule of local anesthetic, and the assistant, hygienist, the doctor, whoever wants to, get the syringe all set up, will put this in the syringe, and the doctor will go ahead and give the injection like he or she normally does. So it's important to note that nothing with your technique is changing. All this is doing chairside is raising the pH level from a 3.5 to 4.0 pH, taking an acid up to that physiologic or that 7.4, that neutral pH that it needs to be at in order for that nerve tissue to have pulpal anesthesia.
So you're essentially looking at a mixing pen that's utilizing the bicarbonate and the anesthetic of their choice.
That's correct.
Got it.
So as I just demonstrated, it's very simple and easy to use. The great thing about buffering local anesthetic, there are a lot of pre-COVID benefits. One is the onset time, which I had mentioned. So on average, you're saving about 10 minutes per patient, or about 2 hours on average per day. Where a lot of offices, you may be productive in those 2 hours that you're essentially just wasting. But what a lot of offices are doing post-COVID, or even before COVID came about, they were able to squeeze more patients in throughout the day. So it's increasing, buffering local anesthetic with the time savings. A lot of offices are finding that they're able to increase their revenue by seeing more patients throughout the day. So one is the onset time. It reduces that onset time per patient. 2 is the patient comfort. The great thing about buffered local anesthetic is you're injecting at the same pH as water and not lemon juice. So it's no longer gonna burn or sting for the patient. It's gonna be a very comfortable injection. Now, pre-COVID, doctors were buffering their local because of the onset time and the patient experience. Now, post-COVID, doctors are jumping all over this product for 3 reasons. 1, they're saving on their PPE. So the great thing about this product is you could seat, treat, and complete.
So they don't have to leave the room waiting for the patient to become numb.
A doctor with buffered local will be able to give that injection and go to work right away. And if you're not currently buffering your local, what a lot of doctors are doing is they give that injection, they leave the room, they go do hygiene, and then they come back about 10 to 15 minutes later. And you know what? Sometimes you come back and that patient's not numb. So what are you doing? You're giving another injection of local. So that 15 minutes all of a sudden turned into 30 minutes. So the great thing about this product is you are able to seat, treat, and complete post-COVID, where you're able to seat the patient, administer buffered local anesthetic, give the injection like you normally do, and treat the patient, go to work right away, and complete. So you're good to go. You can treat one patient at a time versus seating a patient, administering that unbuffered local, giving that injection, leave the room, bounce from room to room, and then come back. So essentially, this is creating efficiencies for your practice, will save you time, it's more comfortable for the patient. Post-COVID, in addition to PPE savings, actually, that's what I was getting to. The great thing about using this product is you're no longer having to don and doff PPE, right? CDC post-COVID has come out and stated if you're leaving the room and you're coming back, you're donning and doffing PPE. So the great thing about this product is there about a 50% savings on PPE because you could seat, treat, and complete that patient. 2 is cross-contamination. You're being able to stay with one patient at a time. So there's that reduction of cross-contamination as you are a vector for whatever you're going to spread. And 3, maintain patient volume. This goes back to what I was talking before about seeing more patients. At the very least, this is going to help you maintain patient volume.
That sounds great. Now, can we talk a little bit about the logistics of it? So you've given us great reasons why we might want to embrace Onset by OnPharma. What about these cartridges? How many injections can we seek to get from one of these cartridges?
It's a great question. So each cartridge of sodium bicarbonate is enough for 20 injections.
You need your drink?
Excuse me. My apologies. So each cartridge of sodium bicarbonate is enough for 20 injections. If you're precisely measuring that 0.09 milliliters of that sodium bicarbonate, 20 injections, the shelf life is 7 days. So as long as you know you're going to go through 20 injections in 7 days, you're golden. So what you're doing is our introductory package to kind of get you started gets you the Onset mixing pen, a 4-pack of the cartridge connectors, and a 4-pack of the sodium bicarbonate, enough for 80 injections.
Now, can we take a closer look at that cartridge connector piece you just mentioned?
Yeah, so whatever you put into the local's got to come out, right? You got to make room for that sodium bicarbonate that you're injecting into the local. So whatever you put in's got to come out. So some of that excess local anesthetic is then stored in the sterile chamber. You could think of it as like a sponge. So after 20 injections, you're replacing the cartridge connector and you're replacing the sodium bicarbonate.
Okay, so I'm seeing 3 different things here. We've got the mixing pen itself, the cartridge connector, and the bicarbonate.
That's correct. So if you take a closer look at this flyer, you see the 1, 2, and 3. These are the 3 components that make up the introductory package. So the mixing pen, the 4-pack of the cartridge connectors, and the 4-pack of the sodium bicarbonate. Once you buy the introductory package, once you have the pen, you're just buying the refill packs of the sodium bicarbonate and the cartridge connectors.
So 2 and 3 would be repurchased on a regular basis, while the pen itself is the initial purchase.
That's correct.
Got it.
Our retail price on the introductory package is $527. Now that's retail. And then, once you have the pen, you're just buying the refill packs. On average, we're finding that offices are spending about $12 to $15 a day by buffering. But again, you look at the PPE savings, you look at the patient experience, you look at the time savings, the 2 hours that you're saving a day by buffering, it truly, truly will make a significant difference at your practice. It's going to make you more efficient and will, again, create efficiencies for your practice. And, I'm really excited to talk to you about buffering. Buffering's been around for a long time, but especially post-COVID, doctors are jumping all over this. I just finished a few days down here in South Florida doing a bunch of live demos at a lot of practices. And it's one of those products that a lot of offices want to try. They want to try before they go ahead and buy it. Now, we do have an offer right now with Benco where we have a buy and try. So for that investment of the introductory package, so for roughly $527, you have the opportunity to try it on 80 patients.
80 patients?
80 patients or 80 injections, or for 120 days. Now, if you're not satisfied with the product, if for whatever reason you're not happy with it, you're gonna get 100% of your money back guarantee.
So really, they have the opportunity to see how this fits into their practice. And you said 80 opportunities, that would be 20 shots for each cartridge, is that correct?
So 80 injections, so it would be 4 20 packs of the sodium bicarbonate.
I understand.
So again, it's whatever comes first. Either you go through the 80 injections or you use it less than 80 injections, but use it for 120 days. Again, once you start buffering with Onset, you're not going to go back to your old ways and go unbuffered. This is truly going to make a significant difference at your practice. So with that being said, I really appreciate the time, and I really hope that you give Onset a try or a shot, no pun intended. But again, if you do have any questions, my phone number is 312-350-7937. I am happy to answer any questions you may have about the science of buffering or about Onset itself. But again, if you are interested in placing an order, you would just do that through your local Benco representative. So again, I really appreciate the time, and I hope you all stay safe and well.
Thank you so much, Spencer. I think you've given us a lot of great information today. I really appreciate it. And thank you again. Thank you everyone for joining us. If you have any questions at all, you know what to do. Contact Corey.